I am Dr. Gary Motykie, and I am a Beverly Hills board-certified plastic surgeon. And today I'm going to be going over breast implants. So number one that I hear all the time for patients coming in for breast implants is that they need to replace them every 10 years. And it's something that's been going on for a long time. I think it was originated from the fact that the original breast implants many years ago were warranted for 10 years. So a lot of patients had that number in their brain. Doctors mentioned it because that warranty ran out. Didn't mean the implants went bad. Same thing as a car warranty. Anything else doesn't mean they're going to explode or anything bad's going to happen. But the older implants, the shells were different. Obviously, they're much better than they were, 20, 30, 40 years ago. These newer implants have much lower rupture rates, much better implants. And so since then, these implants have now become warranted for a lifetime. Doesn't mean they're a lifetime implant, but it's just now they are warranted for a lifetime. So that 10-year rule really isn't a rule. And even back in the day, it didn't mean you absolutely had to have your implants in place to 10 years. It's just that the warranty ran out. So a lot of doctors at the time recommended, okay, replace them. I'm not saying it was used to redo surgery, but it is something you should have been aware of back then, that the warranty is 10 years. But now, don't fall for that. Unless you're having a problem, an issue, you want to change something, you don't have to replace your implants. If you are using silicone, you do want to monitor them. You do want to make sure you're not having leaks. The issue with it is that they are silent leaks. If it does leak, you don't know it. It doesn't do anything to you. And I think one other thing a lot of people should be aware of is that all of the newer implants are not liquid silicone. The old implants that there were issues with, problems, were liquid silicone. So if you cut them, they could leak, they could seep into the tissue, they could even get to the lymph nodes. But if these rupture, these implants are called cohesive, or more like a jello inside. So if they rupture, they don't leak in the body, they don't go anywhere. So the best way you'd notice something like that happening is the breast changed shape or something seemed different. And then that's the point when you may want to go get imaging done on the breast to make sure it's not leaking. The other thing I want to let people know is any implant or anything you put in your body, a lot of people say, well, is it for a lifetime? I want something for a lifetime. And not necessarily. I mean, we all change. We all have, we get older. We don't want the same things we wanted in our 20s and 30s. So a lot of women that went larger when they're a little younger may want to go smaller. So probably before or right around that 10-year mark, most women want to change their breasts anyway. So they want to go smaller, they want to change the type of implant, maybe there's a better implant. So just know overall that the implants, although they're warranted for a lifetime, you probably won't need it. You probably want to change it, prior to the entire lifetime. And any reputable surgeon are going to be warranted for a lifetime.
So even though you might want to change it, you don't have to.
Yeah, the only reason to change it, is if you wanted to. Unless there is an issue, there's still a risk of rupture in these implants. Very low, but it is possible.
If they're ruptured, then is that covered under the warranty?
Mm-hmm.
Okay.
That would be why they're warranted.
I don't know.
Yeah, so the other thing with the newer breast implant warranties are they cover other things now too as well. So as the implants have gotten better, the companies have been competing, that's good for the marketplace so that they all keep upping their warranties. Some cover different things, so you want to check with your surgeon, what is the warranties, what type of implant are you using, what is that specific implant warranty for, because some of them cover things like scar tissue development or capsular contracture. You can buy optional warranties. There's a lot of things you can do with these breast implants that people aren't aware of. I think any reputable surgeon is going to be using any of the companies that are, have good warranties and great rupture rates. Now there's differences again, so you want to ask those questions, but overall, any of these implants are going to be, high quality that are, that any reputable surgeon uses in the United States. One other thing I want to go over on breast implants is sizing. I get a ton of questions on this, and it's very confusing for anybody, but particularly women going on and looking at online at implants and be like, well, this woman has 450 and she looks smaller, and this one has the same but they look huge, and I'm so confused, what is the sizing, what size do I need? That's going to get very confusing, and it has a lot to do with how big the breasts were when they started, how tall they are, what's their bra size, is it a 32, a 34, a 36? All of these things are going to change how big the same size implant will look on somebody. So when they come in saying, I want a 450 or 500 cc because I saw this online, that's not the way to do this, because you have no idea, how big that person is, how tall. Like I said, there are other proportions. So one little trick I think you should do when going in is to bring pictures of breasts you like or proportions on a particular person that's similar to you, and let the doctor translate onto you what that size will be. Because otherwise it can get very confusing. You know, if you're 5'2" and you have a 350 cc implant, or you're 5'8", it's going to look very different. So you want to take some time to discuss those things. So one last thing I want to bring up is a lot of things in the news about breast implants and cancer and problems and issues, and it's a little bit of a hot topic. You know, I don't want to get burned. But these textured implants are the ones that were having issues versus these smooth shell implants. These came onto the market with the thought of they would cause less scar tissue reaction in the body. I never used them because I never liked the idea of using a rough shell implant. And they typically were also used because the rough shelled implants were also shaped. So they weren't round. And the reason they were shaped like this, and there's a little mark to make sure it's centered, is they could, they would stick and hold wherever you put them in the body. But if they didn't and they rotated or changed, it would look strange in the body. So a lot of these implants, again, aren't used as much anymore. And definitely not anymore because of the problems with this textured or rough shell. So that's something you want to know about as well when picking implants and asking your surgeon about it. I also didn't like these because the shells were thicker. I noticed patients complain of rippling more. The shells were thicker, much firmer. And then lastly, a lot of people ask about something called gummy bear implants. Oh, I heard about these gummy bears, they're the best. And they were very hot, maybe 4 or 5 years ago. Again, the problems were the majority were textured. There are some newer implants in the market that aren't as firm or highly cohesive gels. But the problem with the really, really firm gummy bear ones were they're so firm you couldn't put them in through a small incision, so you'd have to make a large incision in the breast to insert them. And so they left a big scar. They're very firm. Women complained they're too hard. They rippled a lot. So a lot of people for the classic gummy bear don't really use them as much anymore.
We've seen these like crazy big boobs on TV before. Those I've heard are not like from standard implants. What is that? Like I've heard you can use like pig skin.
Yeah, I mean, we've all seen on the internet these women that have these giant beach balls on their chest and they're extremely obnoxious, and you say, how did that happen? There are some ways to do that. Obviously, again, something I'm not a fan of, because when you get into those extremes, you always get issues. But just so people know, in general, breast implants, the ones in the United States, range from about 100, 175, maybe slightly smaller, to about 800, and in silicone. So the largest really in silicone you go is somewhere in the range of 800 cc's. Now with saline or the water ones, you can overfill them and even get a little bit bigger. So some people will take a saline implant, overfill it up to 1,000, 1,200, and that is possible. And then there are, what some people do is there's custom-made breast implants you can order from different countries, different things where they're silicone but much larger. There's crazy stories of people stacking more than one implant in their breasts. There's women that will put an implant plus other things, plus fat, plus fillers, plus injectables. Yes, they used to put in alloderm, strings of things in the breast, but the breast would look, again, deformed and lumpy. So there's ways to do it, but in traditional, common sense, smart surgery, the biggest you're going to see as far as the silicone is about 800 cc's. I'm not trying to promote any brands here. Like this.
Yes, but stay still. Okay. Bring them forward one more time. Mm-hmm. Very good. So the furry one is textured, mm-hmm. and then the other one is
smooth.
And that's the better kind, right?
Better kind. I recommend the smooth. I've never used the textured. Just too many reasons to not use it, and why risk it? To my mind, use the safe, time-tested, workhorse, and this is the one that really does a great job. It's soft. It doesn't have any of the issues as this one has, and overall, I've just seen a lot of patients that want these out and these in.